Hi, I'm Tom Lytton-Dickie, the founder of Meaningful Business, and today I'm delighted to be joined by Snigdha Sahal, who is the Exec Director of Action Against Hunger in India. So Snigdha, thank you for joining us.
Hi, Tom. It's such a pleasure to talk to you every time, and I'm very grateful for you all inviting me over here. Thank you so much.
Not at all. And so Snigdha is here today to talk a bit about her personal journey with mental health during the current environment. And this is part of our Mind Matters series that we're running in partnership with the Z Zurich Foundation, where we're exploring how business leaders and humanitarian leaders are looking after their mental health right now, and also prioritizing the well-being of their teams. So Snigdha, if you can just start off by you telling us a little bit about the work you do with Action Against Hunger in India.
So Action Against Hunger is actually a global network of multiple countries. We work in 50 countries. India is one of the network countries. We work with maternal and child health and nutrition, which we all understand that has completely gone for a toss with the pandemic. Especially the rural poor and the urban poor have suffered a lot. So the primary role that Action Against Hunger does is manage undernutrition and malnutrition in children, prevent them, detect them, and treat them. And with the pandemic, we've also undertaken a lot of relief work, because this was also the time when we realized that our presence was needed more than ever before. So this is in short what we've been up to.
And in terms of your personal role, I mean, let's just, in terms of your team, how big a team do you manage? What does your kind of day-to-day look like?
So we are a team of around 200 people. We're spread over 4 states in India. The 4th state is fairly new. We're just beginning. But in the 3 states, we have fairly large programs. An interesting program is in also Mumbai itself, because we are one of those few organizations that do both urban and rural malnutrition, work on both urban and rural malnutrition. So what does my day look like? Right now, my day looks like back-to-back calls and Zoom meetings, preferably without my camera on. But I think one of the key responsibilities, obviously, like any other CEO, is to grow the organization, ensure that the team is a high-performing team, ensure that whatever you strategize is a bottom-up strategy and is taking the community's perspective, and then driving a strategy, and obviously then implementing and ensuring that impact is being created. The donors keep putting their faith monetarily to us, and we are transparent and accountable to them. So these are my various roles in short. I think that in the last 8 months, this has been tested, I'm sure for everyone else, but this has been truly tested. This is your salt has been tested, because it's every day is a new day and every day is a new struggle. So yeah, challenging, but very exciting times, especially for Action Against Hunger, because we've actually been doing very well. We've, beyond what we had originally planned and what we had originally thought of. We could not only deliver, but we could actually do more than that. So we're kind of proud of ourselves. Yeah.
So you should be. That's amazing. And just tell us, why are you kind of keen to talk about mental health today?
So talking about mental health is actually acknowledging that I'm human and I have a mind. So, and, just like your physical health has a lot of, a spectrum from a flu to a fatal disease, so does mental health. And it's very unfortunate that people hesitate in talking about it. Whereas everyone falls on the spectrum somewhere or the other. From, every one of us falls on that spectrum, but don't want to talk about it. So here I am, not in a sermony mode, but only just sharing that it is absolutely okay to be human.
totally agree. And if we look at the last 8 months, and obviously your role as CEO of Action Against Hunger in India and providing support for vulnerable communities around the country, how has those combined challenges and obviously anything in your personal life affected your own mental health?
So, the pandemic obviously has impacted everyone in varying degrees of intensity, from financial security fear to health and safety fears. Everyone has experienced stress and anxiety. But as a leader, I think that this stress gets compounded because you are assuming these fears and stresses of everyone in your team to yourself. So yes, that itself, I think, underlines a sudden spike in the stress and fear levels. When this also happened at a time when we had just about finished finalizing our strategy and our plans, and pretty much soon after we had to like redo everything. I'm sure others had to do the same, but redoing the entire planning, looking at everything from a constrained perspective and not from a normal abundance perspective. It isn't easy. Again, every CEO or every leader's role is to manage expectations of all the stakeholders. But when all those expectations are layered with panic and reaction, then it actually is up to the leader to diffuse the situation. So the buck stops at the leader. So it comes from everywhere. Again, when we started, when the pandemic hit and we decided that we will take up relief work, we really wanted to do something for our communities, and we decided that our teams will go out and work on the ground. That was not an easy decision to take because the world was in panic and it was a question of my team's safety. So that was also fairly a stressful time. And, even after that, every day the problems are so unique that either there's a setback or suddenly there's a very creative solution. So someday one rains and someday the other flows. But but that is, I think, that has now become a part of your daily life. But however, as I was just saying, that we were able to keep the faith of our communities and also our donors. And we've actually, I believe that we've come out stronger in these months than we planned to or than we could have. Similarly, personally, I think the lockdown, everyone knows that India has had a very different version of lockdown. You've probably, everybody's seen how stringent it was. It was, especially in Mumbai, it was a very, very stringent lockdown. It has relaxed a lot, but if you're sensible, you would still isolate yourself. So this whole lack of social interactions, not being, not meeting people, especially not meeting family, that isn't easy. That isn't easy at all. If your family stays 20 minutes away and you're still keeping a distance from them, that doesn't, that doesn't fare well with me. My parents' health has always, has been very precarious. So managing their health remotely sometimes also we can go visit them. So now visiting them, managing their health in this pandemic, it has been not easy at all. Constantly worrying and not being able to do a lot is a big challenge that has been plaguing me. I think also I'm sure that I'm not the only one. I'm very sure that everyone has been, this is such a tough year, but I think for me, one of the biggest realizations is that, or let me not say realization, let me say the biggest help has been knowing that I'm not alone. like all of us are in it together, and it's not me, it's all of us. So I think that's been an interesting way or interesting perspective that has kept me going. But yeah, it's not been easy. It's been stressful. Yeah.
And so just to kind of break that down, if on a day-to-day basis you're obviously making critical decisions, sometimes life and death decisions, and it's changing every day what that might look like, plus everything in your personal life. How do you cope on a day-to-day basis? Do you have any specific mechanisms or techniques and tools that you use to try and keep yourself in a healthy place?
So yes, I've done some things, with so much of your personal life and your work life that was all merged into one. There was there were no, everything was a blurred line. I was doing, I was doing work till late in the night. I wasn't really demarking any of this. There was a lot of work at home that was getting mixed with work. I think one of the things that made me a little saner was I decided to demarcate time and space for work and for personal life completely. So I have tried my best to say that this area of my house is where I work, and this area of my house is where I do not work. So I do not carry my laptop and sit in various corners and continue to, which I was doing. I do not do that. Similarly, I now try my best to not work after a certain point of time in the evening. I have figured out a way to unwind and to switch off and to do that transition. And as far as possible, I do not merge the two because it was really getting too much. Apart from that, I meditate daily. I think that has been my core. That has been my core anchoring system. It keeps me, of course, it keeps me calm. It also helps me empathize better, understand other perspectives better. I completely know that when people are reacting, it is because they are suffering, and not because of anything else. So for me, that has been one of the biggest contributors to my sanity.
Yeah. And what does good mental health look like to you? How do you know when you're in a good, sane, calm place?
Before I move to this, let me also quickly tell you a couple of other things. Especially with our team, what we did, we started doing fortnightly socials where we would not work, but we would party.
Yeah.
I think that has made us so fond of each other, which we were already very fond of each other. But I think that, we've realized that once in 2 weeks meeting on a Zoom call and having a blast and having fun and teasing each other and having a theme and having a no work talk at all, that has bonded the team better, makes you feel like you're going to office, because office is a mix of that. You interact, you make bonds, and you also work. I think the other thing that I've also been on a quest is I've been trying to do a lot of nutritious, focusing on nutrition, eating healthy, figuring out what are the, so that is another, I think we are what we eat, and we eat a lot of junk. So trying not to do that. The last thing, I think the last coping bit is that I've tried my best to engage in a lot of creative and enriching activities. I read a lot. I also started writing. So not that I'm a writer, I'm probably average, but it just lets me, really release any pent up emotions or any pent up or any creative ideas that I have. So I think a combination of all of that is what, has what kept me um, balanced, if I may say so. Uh, to come back to your question, Tom, that, what does good mental health look like? I think anyone who says, oh, don't get stressed, take a chill pill. I don't think so that that's what, a good not good mental health. That isn't a sign of, good or bad mental health. I think taking a stress or, and fearing things or experiencing your own insecurities and fears is all very human. I would say that a good emotional and mental well-being is when you have a very healthy inner environment, and that inner environment is helping you cope with all of this anxiety, all of this stress. You are very aware of the fact that, okay, this is a point where, this is my stress level. I have reached this stress level. So this self-awareness is what a good mental health environment or emotionally well environment would look like, when you're self-aware that, okay, I have reached a point. I know what buttons de-stress me. I know what buttons keep me healthy. I'm going to push those buttons. I'm going to go through my regime. If I have to sit and meditate to calm down, if I have to do my thing, whatever my thing is, music, I will do those things. So knowing yourself well enough is what I would say um, is a clear indicator.
Yeah, I think hopefully lots of people know themselves a bit better now than they did 6 months.
Yeah.
And so my last question then, Snigdha, is what is your best piece of advice, or a couple of bits of advice to others who maybe aren't quite as well equipped or are struggling right now to maybe cope better?
I think I don't have any big advice, Tom, but I think knowing that, as I said, knowing that you're not alone, and hence not hesitating to reach out to your support system, whoever that may be. Maybe you have therapists, maybe you have friends, your family, whatever your support system is, talk to them, reach out to them, reach out to them again and again and again, is one big thing. Not being a psycho about nutrition, but I think eating healthy, figuring out what is nutrition will really help you in the long run. And third, find your spiritual anchor. Find what keeps you there. Meditate, chant, pray, whatever is your thing. But do that, and do that as a vow. Do it. Practice, practice, practice it. Don't lose on that. Yeah.
Perfect. Thank you so much, Snigdha. And honestly, we really appreciate you sharing your kind of personal journey with us and your advice. We are going to be
in
this conversation throughout the month, and obviously we're culminating in an event on the 29th of October. We'll be bringing together experts, entrepreneurs, and leaders around the world who'll be sharing their own journeys of overcoming mental health difficulties, but also talking about how leaders can prioritize their well-being and that of their teams. So we hope everyone here watching and listening can join us, and obviously you are very much invited to think that as well.
Thank you so much.